Good morning, Brother B. Good morning. How are you?
And I'm all right. And yesterday we celebrated we celebrated Spiritual Baptist Liberation Day, and of course, and we send greetings to our brothers and sisters. Yes.
Yes, certainly, certainly. I know that we had to celebrate it a little differently, but the Lord God is good. And we know spiritual Baptist people are resilient people, so we could also overcome this.
Very good. All right. All right, let's get into it. The do's and don'ts of COVID-19. Obviously, we are not allowed to go out. I just want you to, I'm asking all our guests to speak to the importance of staying indoors. Obviously, it's a practice around the world presently, given the fact that we have to treat with this situation. So just expound a little bit on that, and then we get into more do's and don'ts.
Okay, so yes, it is absolutely critical that we do stay indoors, because the idea is we need to ensure that we separate ourselves from anyone who may have COVID-19, or if we have COVID-19, that we protect others who don't have it. So it's really a two-pronged approach. You need to behave as if you have it and behave as if everyone else has it, which means you stay to yourself, you stay inside, you do not go out and mingle with other people normally. Because the thing is, we are now recognizing that we may have what is considered community spread here in Tobago. And because we have what is considered community spread, we don't know who the confirmed cases have come into contact with, and they may come into contact with someone who has come into contact with you. And because you don't know that you have those contacts, you now bring it into your family simply because you went out the road and lied. And that is not a good enough reason for you to now put your family at risk.
Great. All right, so so that's one. Clearly, we have to go out, get basic necessities, bank transaction, groceries, and so on. Guidelines. Obviously, we know we have to keep our distance. You gave an example the last time someone was standing too close to you. If you're in a line and you notice someone is standing too close, you're not comfortable, what advice would you give them? You use your example, but I want to speak to that again, because in some cases, people still feel I could go up as closer and talk in the ears and tell him, you can find that line here too long. Just talk to us about, from that standpoint, what your rights are as an individual, as to try to have a comfortable distance away, and why.
Well, it's critical because it's important for you to be able to say, hey, you are standing a little too closely because this is not 3, and actually the requirement is really 6 feet away from me. And this is a time where you need to be rude if you need to be rude, because you are protecting yourself, you are protecting your family's health. So we need to think about it. I think that we are absent-minded, and I think that we are so used to being close-knit that we do not think about it all the time. So it may be that the person isn't even conscious about what they are doing and how close they are to you. But this is an opportunity for you to then say to them, hey, maybe step back a little bit. And you also do it by example, by stepping back from the person in front of you, and ensuring that you maintain that distance in the front and the back of you.
All right, let's go over this, and we need to repeat this over and over because it's very, very critical. The whole question of sniffle and sneezing and coughing in the public. Obviously, we were cautioned, or we were told to cough in the cup of your elbow. Yes, so just let's go over that so as people get it. If you're out, sometimes it is not that you have anything to spread, but sometimes you do sneeze normally, naturally, and so on, because of something that you might have inhaled. Let's talk to that a little bit.
Well, that is important because what we know is that the virus is encapsulated inside of the liquid that comes out of our nose, comes out of our mouth when we sneeze and cough. But it's important for us to know that there is enough research now showing that the virus actually also comes out of our mouth when we speak normally. So even if you are not coughing, even if you are not sneezing, but the fact that you are speaking, it means that boulders come out of your mouth. And if you are in the phase where you have a lot of the virus multiplying and shedding, it means you can also spread it just like that. I actually shared a video yesterday or day before yesterday on my Facebook where they did a simulation of people sneezing, and they were able to kind of light up the boulders so that you could see them on a camera.
Wow.
And it was so interesting to see how much of those boulders fall to the ground quickly, the heavier ones, but there are some micro boulders, for want of a better term, that stay around in the air a little bit after the fact. So you may have sneezed and walked away, but somebody who is walking behind you now comes into that and now is inhaling that, which is why, again, it's so important for you to stay home, because you might be telling yourself you are staying away from people who are sick, but you don't know that the person who just sneezed in the area that you are now walking into. So that is why it is so absolutely critical.
Very good. Let's go to, I heard the Minister of Health spoke about, obviously we can't bury our dead, those who would have passed as a result of COVID-19 and the exposure. Let's talk about, this whole question of, you're mourning your dead, you've gone to see the body, they might have called you in to identify the body, and you start to bawl. You're going and hug up the dead and say, oh God, why you had to leave me, and so on. And you may have overcome with grief as a result. What would you advise people who would have lost? Thank God, and let's hope and continue to hope that we don't lose more. But in the event that you have to go visit your dead and someone has passed away as a result of COVID-19, what advice would you give to them?
Well, the advice really is to them, but the advice also is to the funeral home and at the morgue and so forth, because they're the ones who need to ensure that they use the standard protocols for that. So in a situation like that, the morgue or the funeral home should not even allow you to come in to see the dead.
Great.
Not in a space where you could actually physically come into contact with them. What I've been seeing them doing in the US and so forth is actually putting up a barrier. So there's a glass and you basically look through the glass, so that you do not come into contact with the body at all. And it's not that we can't have funerals. What we can't have is the typical funeral that Trinidad and Tobago is used to, the wake and the funeral and then the repast, where we have all of these people congregating. Because you have to also remember that if it is your family member just died from COVID-19, depending on the situation, the family may also have been exposed, depending on what happened. And it means then the people who now go to the funeral or go to the wake or go to the repast now may be further exposed unnecessarily. So that's why they've been limiting that, no, you can't have these large masses. So it's not like we can't have funerals, you just can't have them in the large masses. Churches are saying no more than 10 people, and you have to still practice social distancing while you are there.
All right, good. And of course, weddings and all of those social gatherings are limited, obviously 10 persons, churches, everybody. So we got that, right? And it's really sad. And of course, we heard the announcement yesterday. Was it yesterday when the minister spoke about not having regular? If you die from COVID-19, you may not even have an opportunity to bury your dead, because the state takes it because of the possible residues from the body, or whether it's from I don't know what part of the body, that you can come into contact with and thereby contaminating yourself. So that has been an issue. All right, moving on from there. Any comment on that at all? You want to just touch on that a little bit?
That's just, if that is what we need to do, that is what we need to do, because we need to protect our people.
Very good. All right. Dr. Faith, are you convinced that we are taking these things seriously? Even though we are hearing the deaths, there are still delinquent people who are breaking the rules, as it were, going out unnecessarily and liming, as it were, in their little corners and things. Do you, and if not, if in your own estimation that you find that people are still not taking this seriously, what would you want to say to them?
Well, no, I don't think we are taking it seriously at all, because I am seeing people who are still going out and interacting, even people who, in my mind, should know better and knows better. So there is something about the human nature and something about us not doing what we should, even though we know we should do it, which makes me think that the government of Trinidad and Tobago, even though we have been urging and prodding and telling people, we need to actually take more stringent measures to ensure that people stay at home and to ensure that the law is on the hands the law can be brought down on people who don't follow the rules. So because it seems like just saying it naturally and saying it normally is not working, because people are simply not listening. And I don't know if it's because they don't care, or they don't care about anything other than themselves, why they would allow themselves to still go out and put so many people at risk. But this is who we are, and sometimes if you don't behave like an adult, then the law would be forced to treat you as a child who needs to have rights taken away because you can't think on your own.
I like the way you put that. Yes. All right, give us a reaction from the press conference on Friday. Give us an overview as to what you heard.
Well, unfortunately, I, like many other Tobagonians, when I sat and listened to that press conference, I actually got a little bit more concerned about our response in Tobago compared to before Friday. Because it seems like when we thought we had things under control, the members of the panel could not answer very, very basic questions about the new case that we were reporting on, where that person may have gotten it, meaning whether they had traveled or not traveled, or any of those things that seem to be very, very difficult things for them to answer, which means we may not actually be following the precautions the way we should. Even the response, Brother B, about what was supposed to happen with the other members of staff, with the person who was confirmed, whether they should be at work or not at work, all of those things seem to be going against what we have been telling the public and what we know is the correct thing. So that was a very distressing press conference for me. I got up Saturday morning really very, very upset about what I had heard Friday evening, and wondering whether Tobago really is ready for this or not. There's also something else that I want to add very quickly, and I am going to say this up front. This is going to be a very political statement, so excuse me ahead of time. The Minister for Health last week announced that there was $157 million that was being released to the RHAs to help them respond to COVID-19. We were in the House on Thursday when that announcement was made, and we were all very happy to say, okay, at least we're getting additional money. As a matter of fact, at first, I thought the $157 million was for Tobago, to be honest. And then we gathered on Friday that the $157 million is actually for the RHAs in Trinidad.
Yeah.
Now, the minister was asked yesterday again, I think, yes, it was yesterday, about what about the allocation for Tobago. And it seems as if the minister said very clearly that Tobago is not going to get any of that money. And if Tobago wants more money, Tobago needs to apply to the Ministry of Finance the same way he applied to the Ministry of Finance to get money for Trinidad. And that just blew my mind. Because if you are the Minister of Health, responsible for health in Trinidad and Tobago, particularly when it's your P&M counterparts running the show in Tobago, where we need to have all of the additional funding, particularly after the debacle that happened on Friday, I would have expected that the minister would be advocating on behalf of all of the RHAs in Trinidad and Tobago, not just the RHAs in Trinidad. So we need to figure out how to tap into that Heritage and Stabilization Fund, or wherever they are getting the money from. Because if Tobago recognizes what's happening, we are hearing about all of the gloves and masks and intubation machines and ventilators and screening machines that are coming to Trinidad. But we seem to be forgetting that it is Trinidad and Tobago has a fight on its hand, because we now have, as it seems, community spread. I am sure before the end of the week, our 2 or 3 or 4 official number will grow exponentially, because we would finally recognize that we do have a greater level of community spread in Tobago, and we have to prepare for that here.
Mm-hmm. All right. CAFRA is still the only authorized authority for testing for COVID-19, and that's in Trinidad. We spoke to this a little bit already, and I've heard the Prime Minister or the Minister of Health saying that some kits or testing kits, if I'm not mistaken, are to come from China, if not here already. Just give me a perspective on that, and what does that do, or what does that say, and where does Tobago fit in all of this? And I continue to argue that when I heard of the allocation, I think I mentioned it to you the last time we spoke, that now mentioned about Tobago was in this conversation. Obviously, we still have to fly out or boat out, as it were, and everybody's happy with that. Give me an overview from that standpoint, these testing kits that are supposed to come from China, and if there's any Tobago, and what kind of, how credible is it, or accurate is it, so as to know whether you have COVID or not, or is it just confined to CAFRA?
Well, the thing is that we currently, you're right, we currently only CAFA is the only authorized testing agency currently. But again, last week, the Minister for Health was boasting that they are getting these new machines, these new kits, and that they are expanding the testing to Eric Williams Medical Complex and to the Trinidad Public Health Lab. And again, we started asking, okay, so what about Tobago? If we are expanding outside of CAFA, because remember the original excuse for why Tobago couldn't get testing is that CAFA was the only entity testing. Now that you've told us that CAFA is not the only entity testing, then we need to go to Plan B, which should also include Tobago. Now, the other thing we need to look at, Brother B, and this is something that the WHO came out with yesterday, I think. There is, the WHO is saying that if you are getting more than 10% of your tests being positive, it means you are not testing enough people. So their ratio is we should be testing so many people so that our positive tests is only 10% of out of all of the tests we do. That means Tobago needs to be ramping up its testing. It also means Trinidad and Tobago needs to be ramping up its testing. But we need to also be conscious of the fact that there are now new kinds of tests out there. We can do rapid tests. The same way for HIV, for example. You go and you do a rapid test, in 10-15 minutes you get a result, and then they send that to the lab for confirmation. There are now tests in the world that allows you to do that kind of rapid test even for COVID-19. So those are the things we should be thinking about. And Tobago needs to start stepping up and thinking outside of the box and not just allowing Trinidad to dictate to us what we should and shouldn't do. Because you are right. The fact that we know we still have to jump on a Coast Guard vessel or beg for a helicopter to come to Tobago to pick up one of our patients is absolutely unacceptable. We should be here setting up testing facilities, setting up treatment facilities, because the most critical part of treatment, Brother B, is having ventilator services, because remember, the virus basically attacks your lungs, so it prevents you from breathing properly. Ventilators is what they've been using to allow you to help the patient to breathe. We should be setting up separate facilities where we just have beds attached to ventilators. So if we have patients in Tobago who need that kind of care, we don't have to worry about sending them to Trinidad. We also don't have to worry about having them in the hospital, because we have a hospital that is not well sealed off. We have a hospital that we cannot really control the airflow in the hospital. So we need to think critically about whether we should have COVID-19 patients in the hospital. There are other places in the world where they have been using all kinds of other facilities, building facilities, as a matter of fact, just putting the bed and the ventilator and the basic equipment that's needed and using those as designated COVID-19 treatment centers. And that is what we need to think about critically doing here. As a matter of fact, we should have already thought about it, and we should have already been getting what is necessary to do that here.
Well, I'm glad that you are the voice that is calling for those facilities to be sometimes I'm afraid to even, I think I spoke about it and I almost got in trouble with it about that. And sometimes I wonder about, Anyway, now, given that we don't, and we still have to ship out, well, it's ship out because we have to use the Coast Guard. When I heard that, I was like, how come nobody else is saying something is wrong with that? I'm glad that you have mentioned that, and I hope that we see that the cases are increasing. It's 82 there right now in Trinidad, and
85.
85.
There was a press
and
conference
let me go my notes here. 85. And let's say, and let's bring Tobago into perspective here again, treating with this whole question of how we treat with ourselves. And you have warned in the Parliament, in the Tobago legislature, and you continue to warn every time we speak to you. Now, and sometimes when you hear a voice because of what the knowledge that you have and so on, and when you hear that and we ignore it, and let me say further because I afraid my own mouth. Now, how do we get the authorities to listen to this need for Tobago to be able to take care of its own to the extent where we don't have to ship anybody down to Trinidad. How can we get some of that services that is available down there here in Tobago, from your perspective, from your standpoint?
Well, this is Trinidad and Tobago, and this is why this is baffling me, Brother B, because again, I am going to be very political. We have a central government in Trinidad that is managed by the PNM. It is a PNM administration in Trinidad and a PNM administration in Tobago. This should be a simple phone call. Hey, boy, how you going? I see only have 175 ventilators coming in Trinidad.
Yes.
Send 10 of them for going to Tobago. Oh gosh, we have an election to win just now. That is the kind, that is, in my mind, that is how simple this should have been. Why are we begging? Why are we behaving as if this is not Trinidad and Tobago? And if we are doing it in Trinidad because we know the risk in Trinidad, that we also don't know the risk in Tobago. And from what I have been understanding, this arrangement where we are sending to Trinidad is something that has not been well worked out. Because we may have a case in Tobago that even if we have the 10 or 20 ventilators, we still cannot treat with that case because it may be so advanced or it may be so severe that we need to take them to Trinidad. That kind of arrangement still needs to be worked out. We still need to have at least 1, 2, 3, 5 portable ventilators so that even if we are traveling from Trinidad or from Tobago to Trinidad, the person is still on the ventilator while making the trip. These are not difficult things to do. Yes, it's going to take money. Yes, it's going to take resources, which again is why I was so surprised when the minister said yesterday that basically Tobago had to fend for itself and Tobago already has its allocations in the TRHA. When we in Tobago know that for the last couple years, Tobago's medical services have been going down the drain. We can't get basic testing because we owe the supplier millions of dollars. So we can't really be relying on the resources that the TRHA has to do its regular work. We can't be relying on that because we know even before COVID-19 that was not enough. So I really don't understand this idea of Tobago would have to ask for itself. Tobago would have to justify why it needs money. No. This makes no sense. And if it is that the Tobago counterparts of the PNM cannot have this rational discussion with the with the Trinidad counterparts of the PNM, then something is very wrong. And we cannot wait much longer than this, because remember, I've always said that we have been a couple weeks behind. We have the benefit, Brother B, of watching what is happening in other parts of the world, watching how their infection rates increase continually. We have the benefit of that now. So we need to be working now as if we see what is going to happen in a week, 2 weeks from now, where we don't have the option of sending to Trinidad anymore. We need to be doing that right now.
Okay. I don't know, some birds are whistling next to you there. I don't know if it's a phone ring.
Yes, it's actually we may need to go to bed because I think it's my alarm.
All right, thank you. And Doc, we want to thank you very much. And I love, and you know, thank you very much. All the best to you. And we'll call you again. All right?
Thank you.
You know, and you know, I feel vindicated, you know, just now there. You know, she used the same, I don't want to say mannerism, but in the same way I would say that Tobago needs what Tobago needs by just a phone call. You would have heard me say that on numerous occasions. And so, anyway, I'm glad it's somebody else saying it and not me, because, you know, they like to, you know, anyhow. Let me leave that. Let's go for a break. When we come back, we have lots more for you. See you then.